Good afternoon, and welcome to this episode of Mental Health Matters, the first one for the 2022 season, where we're going to be talking about building resilience throughout the year. The program will be airing the last Wednesday of every month at 4:30 p.m. on Facebook, and then it'll also be on our website and multiple other channels. And we'll be featuring leading mental health experts, educators, students, discussing practical tips, tools, and resources to effectively navigate and cope with the current mental health challenges that our youth are facing. First, I want to thank Children's Services Council of Martin County for supporting this effort. And today, let's get started. We're going to focus on the current mental health of our youth in the communities we serve throughout the Treasure Coast. And I'd like to start by introducing our guests. We have Garza, who is the CEO of Tykes&Teens, a leading provider of children's mental health services for 25 years now. And we're currently serving Martin, Indian River County, St. Lucie County, and Okeechobee. And Eric holds a Master of Health Administration and is a licensed clinical social worker. We also have Brett Hall from Indian River County, who is the Executive Director of the Mental Health Collaborative of Indian River County, whose mission is to establish a continuum of care for mental health made up of private and public funders, mental health providers, and individuals who work in collaboration to increase access, decrease duplication, and facilitate community-wide support of mental health issues. Brett also holds a Master's of Business Administration and is also a licensed clinical social worker. So thank you both for being here with us today. Today we're going to focus on the mental health crisis as we're continuing to get through the COVID pandemic. And a recent U.S. Surgeon General's advisory specifically on youth mental health brought to light several alarming statistics that we're currently facing, and it showed that 1 in 5 high school students, including 50% of female students, are reporting persistent feelings of sadness, hopelessness, and an overall anxiety, which is an increase of 40% since 2009, so a pretty sizable increase. And since the pandemic began, rates of psychological distress among young people has also further been exacerbated by the pandemic. So we're 2 years into the pandemic. Where are we from a mental health perspective, and how is it continuing to impact the children and families? Are we seeing those same types of numbers here on the Treasure Coast and in Okeechobee? So let's start with you, Eric. What are we seeing at Tykes&Teens in terms of increases?
Right, so I can say in terms of increases, we've definitely continued to see an ongoing increase of client referrals for individuals who not just have 1 or 2 adjustments in their lives, but multiple adjustments of family members passing away, family members having to quit their jobs, so many adjustments that they're going through. Our wait list continued to grow. Our demand increased by 300%. The amount of clients that we have receiving care going past 8 months continues to grow higher. And so typically the length of treatment that we would have at Tykes&Teens would be about 6 months. And so now what we're starting to average out is a little bit more between 8 to 12 months. So demand across all 4 counties continues to be high.
And Brett, from your perspective here in Indian River, as well as throughout the area, are you seeing the same types of things? What are you seeing, or what do you expect to see as we go into this year?
Yeah, we are seeing very similar things in Indian River County, and as a nation as a whole, just speaking from a macro level, pre-COVID, 1 in 5 people had symptoms requiring a professional. During COVID, that's now been 2 in 5. So we have doubled, so that's 40% of our population requiring intervention of a professional. So we also saw the APA, American Psychological Association, came out with a study last year that said 70% of 16 to 24-year-olds were reporting increased depression and anxiety. That's 70% of that cohort. We're seeing lots of young adults, and I'm really concerned about this age group, the whole 16 to 24. This is a lost generation that we're really going to have to pay attention to. These are folks that are starting to break away from their family systems, trying to be an adult, go away to college, go get their job in an apartment, and their life plans have been derailed. So we're seeing a big increase there as well. And unfortunately, this is not the end. I mean, we've doubled the need since the pandemic started. And according to FEMA, the peak of psychological crisis, or the peak of psychological distress, will happen 12 to 18 months post-event. Right. We're not post-event yet.
We're post-event.
So we're 2 years into the pandemic, but we have another year plus before we see the peak.
So we're really working on preparing our community for what's happening now, but also trying to prepare them to what's coming. We know that things are tight now, but it's going to get worse.
So what are some of your recommendations for those that are struggling right now? How can we best support and help them with coping mechanisms? What do you recommend?
Well, we know,
or as a community, what can
we
do?
know early intervention. The sooner you can get to a professional when you start having symptoms, the less intense treatment you're going to need, the less length of treatment you're going to need. So let's grab these things at the early stages before it really develops into, developing symptoms or even crisis at that point. Because we can move people through the system a little bit faster. And that's what I really want to work on, is preparing clinicians to how do we move people through the system a little bit faster so that we can continue to have intakes on the front end. So what kind of supports do we put in? First of all, how do we get them in earlier? How do we identify and get them in earlier? How do we move them through the system a little bit faster using evidence-based practices? And then what supports are we putting around our community once post-discharge from services? So therapist-led support groups or online support groups, or what some of those look like.
Yeah, because what we know, and I forgot what the statistic was, but there's a certain percentage of individuals who, even though they have symptoms of depression, anxiety, they don't seek treatment, and it's one of the worst statistics when it comes to self-care and taking care of things. And so as adults, if we're doing that, what are we role modeling to our kids, when it comes to self-care and taking care of things before they continue to snowball and get worse? And it's kind of like if you have a broke leg, you're not going to wait that long to go to the emergency room to take care of it. And so if you're struggling with anxiety or depression, you really don't want to take too long with it. And aside from that, as Brett was talking about, just continuing to have ongoing discussions in the community, how we're doing right now, prevention is key. How do we keep giving community partners, individuals, parents, teachers, police officers the tools that they need to be able to identify some of the symptoms and be able to help individuals from an early situation, as opposed to letting it snowball.
Mental Health Collaborative, all about collaboration. What are some of Tykes&Teens is part of that collaborative? Who are their resources, and how is that your organization helping facilitate this whole concept of we need to come together as a community for the future of our community?
So the collaborative is all about increasing access to mental health services. I do that on a 3-tiered objective. One, do we have enough programs and providers to meet the needs of our community? And that's ongoing. But we got involved with bringing an IOP to town and finding some money to help support an adolescent IOP. We work on providing evidence-based treatment to clinicians to make them better at what they do. So we're supporting the clinical community that way, increasing access. The number 2 is, now that we have the programs and providers, what stops people from, accessing? Well, they're hard systems to access. I make 5 phone calls, I have a 2-month wait list, you don't take my insurance, and now I'm frustrated. We run the McCabe Connection Center. It's a one-stop shop, 1 phone call, 1 walk in the door, and we will tear it apart for you. We will figure out what exactly you need, provide options for you, educate you on the difference between a psychiatrist and a therapist and what might be best for you, or you pick what would be best for you. Then we make the appointment for them to get there. And not only like, here's a number, good luck, we make the appointment. We make sure that we remove any barriers to getting there. Do you have transportation? Do you need childcare to get to this appointment? So we make it easy. And then we work on the whole person, the biopsychosocial model. So now that we've attended to your psychological health, when was the last time you saw your primary care physician? Who are you socially connected with that's going to support you in your role? And then the third objective is, now that we have the providers and an easy way to access them, what stops people from accessing? Because according to Mental Health America, the average time between symptom development and people actually getting into treatment is 10 years. 10 years.
It's crazy.
So what is that? And that's stigma. The stigma that's attached, and the systems are hard to access. So we're doing mental health literacy and mental health awareness campaign launching off in Feb this month. We're also running mental health first aid, which is a really great curriculum that everyone needs to take. We were recently funded by Johns Island Community Service League to train 11 more instructors to teach mental health first aid. So there's 13 of us running around the county right now. Our goal is to train 1,500 people in the community a year. And this is the CPR equivalent for mental health. So CPR teaches you how to identify medical distress, stabilize, and get them to a professional. That's what mental health first aid does. How to identify signs and symptoms of mental health distress, stabilize, and get them to the appropriate professionals. Great program. On our website, mhcollaborative.org, there is a link that you can sign up for mental health first aid. If you're a resident of Indian River County, live, breathe, touch somebody in Indian River County, you can get that $150 training for $20.
So MH Collaborative, we'll make sure to have the link on our website as well. And Tykes&Teens has a number of, a full spectrum of services, but one of the things you both touched on is that prevention is key right now. And we have a number of prevention programs and services that we offer as well, and additional resources. Those will be on our website, tykes&teens.org. A lot of doom and gloom, increasing numbers, increasing need. Can you give a few, is there a ray of hope?
Of course, I think in doing our clinical work, we've seen several traumatic situations with clients. We've gone through hurricanes, we've gone through so many things, and humans are resilient. Humans always bounce back. If humans are given the opportunity to be able to overcome things, then that's what we do, and especially with children. And I always kind of look at what's the advantage of our children going through a pandemic right now. What type of resiliency is it building in them, so that they can develop these strengths, these resources, so that as they develop and grow and move out of their parents' home or go to college, do some trade, think about all of the things that they've gone through right now that they can use to then look back on and say, if I was able to overcome those years, I'll be able to overcome this, and compare it to this, which is a lot of change for them. And so in my experience, as long as kids get that opportunity to be able to process, speak the unspeakable, and deal with the shame and move forward, then this is going to build up a lot of resiliency for them as they get older. So do you see it any?
There's hope.
Absolutely. 40% of the population is dealing with stuff right now. So
tough.
You're not alone. Lots of people are dealing with stuff, but there's lots of great providers, there's lots of great programs out there. And what we need to remember is just that good self-care. We can't take care of, and particularly as us individuals, as parents, as teachers in the community, we can't take care of the world until we're taking care of ourselves.
Right.
We have to do this. And I love this concept of introvert, extrovert. It's, an introvert will leave the house with 5 coins in their hand every morning. And every significant social interaction they have, they give away a coin. Well, that drains their energy, right? An extrovert leaves the house with 0 coins, and when every significant social interaction they have, they gain a coin in their hand. So they're drawing energy. So let's just talk about that at the macro level. Know what gives you energy and what drains your energy. Once we're aware of that, we can take our good, we can do good with self-care. So know what drains your energy, and we can't help that. Life drains our energy. Right. But we have to know what gives us energy, and make sure that we're doing those things.
That self-awareness is very important. And I think the other part that gives us hope is the ongoing collaborations that we continue to see in the community. Not one agency is going to be able to take care of this, and so it's organizations like what Brett has, and others throughout the Treasure Coast that have really come together to be able to support each other and be able to support the clients, because what one can provide, the other one may not, and we've been able to offset some of those resources, which has been really nice. And again, I give Brett a lot of credit. Since I started in this role, he was the first person that I called, and he said, "This is what we have, this is available to you." And it's really collaborations like that, and we've seen a lot of that during the pandemic, which gives us a lot of hope.
This too shall pass.
Yes.
Well, thank you both very much for sharing your insights with us today. mhcollaborative.org, Tykes&Teens.org, a lot of additional great information, resources to look at and reach out to us. Our next Mental Health Matters episode will air on Wednesday, March 30th at 4:30 p.m. and we'll be discussing social media and technology's impact on the mental health of our youth. So thank you both again.
Thank
Thank
you.
you.